يعطيكم العافية. أنا الدكتور محمد حمدان، واليوم عندنا ضيف مميز اللي هو الدكتور بيني سبستيان. الدكتور بيني سبستيان صديق عزيز، وهو من الناس اللي علموني زراعة الدعامات بطريقته قبل 10 سنين. يمكن كنت عنده بفرنسا وتعلمت منه زراعة الدعامات الهيدروليك. الدكتور بيني سبستيان زارنا في الأردن، كان عندنا مؤتمر مهم لزراعة الدعامات، واليوم اشتغلت أنا وياه 4 حالات دعامات هيدروليك، أفرجيه طريقتي في زراعة الدعامات وأشوف طريقته برضو في زراعة الدعامات. بهاي المناسبة السعيدة بدي أسأله عن أكثر 5 أشياء خاطئة الناس بتفكرها عن دعامات الانتصاب، وخصوصا الدعامات الهيدروليك، عشان نستفيد من خبرة الخبير. إحنا دائما نستضيف خبراء من جميع أنحاء العالم. Welcome Dr. Sebastian in Jordan.
Thank you very much.
It's a pleasure to have you here in Jordan. I used to visit you a lot in Paris, right? And as I mentioned to the people, you taught me how to do penile prosthesis 10 years ago. And here we go in Jordan, working together in penile prosthesis. So thank you so much for coming here. It's a pleasure always to work with you.
It's a pleasure for me to be here again, of course. We were working together a few months ago.
Yes.
And today I have the pleasure to be with you in the operating theater.
It's my pleasure.
And to work with you today.
Okay, good. So, Dr. Billy, I want to ask you about the wrong ideas that people think about inflatable penile prosthesis. So, always people ask me in my clinic, does the inflatable penile prosthesis will affect my or my wife's pleasure during intercourse? What do you think about that?
I think the answer is, of course, no. It will not affect the pleasure because it's the device, the inflatable penile prosthesis, is allowing the patient to have a good erection, and especially an erection that will last in time. So we know those patients, they have been suffering from ED for a long time. They had difficulties to keep the erection, so they were sad, and it was difficult in their couple. So now with the inflatable device, they are able to have a good erection, keep it as long as they want. So I would even say it's better.
Yeah, sure. The second most common question, does it affect the sensation?
No, so it's only a matter of rigidity when it comes to inflatable penile implants. So it will not at all affect sensation which comes from the nerve. So there is no alteration of the nerves when we do this surgery, especially with your technique, which is the pinoscrotal approach.
Yeah, because we are away from the nerves, right?
Yes. Yeah.
So we do not affect the nerve at all.
No.
Okay, the third thing, does it affect the length of the penis, which is the most common question everybody asking me about it?
Yes, actually, it's very often that patient will talk about it because they will read on the internet that sometimes this surgery will affect the length. Actually, what affects the length is the erectile dysfunction itself, especially if it has been there for a long time. So as soon as the patient knows his erection is bad and the medication is failing, he has to think about penile implant and not to wait too long, because if he waits, his penile will shrink. So it's not because of the surgery, it's because of his severe erectile dysfunction. And more than that, now we have the technique that you are using that's sparing the tissue, the cavernosal tissue, the oversizing that allows us to improve the length, especially now with the new devices from Rigicon.
Sure.
That grows in length, so there's no problem during the surgery.
So not doing the surgery can cause decrease in length, not
Yes.
doing the surgery.
Yes, not doing the surgery, keeping your problem of erection while you are thinking about it. If you go too late, after a few years, they come to you, then their penis is shorter.
Sure. So another question, does the penile implant can affect the ejaculation, or can it affect the possibility for having kids in the future?
Yes, that's a classic question. Actually, no, because what we do is we will put inside the penis the 2 cylinders inside the corporas. So we are away from the urethra, away from the prostate. So we are absolutely far away from the structure that will give the ejaculation. So there's no alteration of fertility.
And the patient can conceive after the surgery. Right?
Yes. The penile implant doesn't give any problem for
And
conceiving.
actually, it may help him, right?
Yes, because it allows you to have sexual intercourse until you have ejaculation. You will not lose the erection. Plus, you have a better couple life. So it's important if you want to conceive.
Another question, does it affect the urination?
So the penile implant does not affect your urination because urination and erection are two different phenomena and they are led by two different structures. So we will not at all affect urination.
Great. Another important question, people worry from doing inflatable penile prosthesis because they worry from, they think it's really complicated to activate it and deflate it. Does it really complicate it?
It's simple. Those devices have been on the market for now more than 30 years. And each year it's getting better and better. So now the pumps are not too big, so they don't show, but they are not too small, so they are easy to use. It's a simple way to activate it. You just have to pump a few times, and to deactivate, just to pump once. So it's very simple.
Yes. Another question. I'm a sporty guy. I'm doing all kinds of sport, swimming, horse riding, whatever. If I put a penile prosthesis, will it keep me from doing my sports?
No, the only important thing is just after surgery, you have to observe a certain duration of time without doing horse riding or cycling or motorcycling until you are perfectly healed. But after that, you can come back to your previous life. I just did surgery a few weeks ago on a guy who is doing triathlon. So he's doing cycling, swimming, running, and he's very young and now he's happy.
And he can do it right now?
Yes.
Okay. Another thing, people are worried from the pain post-operatively. Some people avoiding this surgery because they think after the surgery there's like a major pain and they try to avoid the surgery. What do you think about the pain post-operatively?
Yeah, so the pain, if patients have pain, most of the time it's because they did not observe what the surgeon has told them. So you need to remain calm for the first week, to wear tight underwear and not be naked at home, to take your painkillers, and to do whatever your surgeon will tell you to do, like ice packing if he needs you to do it. And in some hospitals, like in yours, even the way that the anesthesiologist gives the anesthesia to the patient is taking the pain level down. So we have modern ways to treat the pain. If you follow the instruction of your doctor, it should be all right.
Yeah, great. Well, Dr. Billy, thank you so much. By the way, Dr. Billy is the highest volume implanter in whole Europe and also in Paris. So thank you for joining here in Jordan. And you are worked with me today, right? And you observed my practice. So what do you think about it?
I think it's impressive because, as you said, I witnessed your very first cases 10 years ago, and I was doing the numbers I'm still doing now, and you were beginning, and now you are doing huge numbers. So you've taken the technique away from where I taught you. So congratulations for that, because you made this surgery even more effective. And what I have seen with your patient, they are very happy from your work. So I'm very proud that I met you when you started.
Thank you so much. Another thing, there is a project with Dr. Billy Sebastian to start doing implant in Morocco. So soon I will announce when and where we will do surgery with Dr. Billy Sebastian together in Morocco for Moroccan people. Thank you so much. Thank you for coming to Jordan again, and see you again in Jordan.
Yeah, thank you.
Thank you. Thank you so much.